Thanks. I am Iliano. I have not disclosure. In literature, there are not randomized clinical trial to compare colposacropexy with subtotal hysterectomy or total hysterectomy. However, the result of the other type trials show that the principal benefit of subtotal hysterectomy was a low risk of vaginal mesh exposure. And the primary aim of this study is to compare the anatomical outcomes and safety of laparoscopic sacropexy with the total or subtotal hysterectomy. The secondary aim is to evaluate the effect of the two procedures on urinary symptoms and their impact on quality of life. This is a prospective randomized study. We included women with POP stage 2 according to POP2 classification, and they were randomized in two groups. The first, the women who performed total hysterectomy plus colposacropexy, and the second performed colposacropexy with subtotal hysterectomy. POP was considered cured when it was stage 0-1. The complications were evaluated according to Cleveland classification. Urinary symptoms were evaluated according to ACS classification. The preoperative evaluation included medical history, clinical examination, urodynamic study, transperineal ultrasound, and the patients completed IIQ-7 questionnaire, UDI-6, and Prolapse Quality of Life questionnaire. The same protocols were performed also during follow-up at 1, 3, 6, 12 months after surgery and annually, except for urodynamic testing. The patients completed also VAS and PGII questionnaire. The median follow-up of this study was 72 months. We included 110 patients, 50 in group 1 and 50 in group 2. In this figure, we can see the cure rate, the anatomic cure rate, and there was no statistical difference between two approaches. As regarding a functional outcome, in this table we can see that there was an improvement in both groups without difference between two approaches. As regards complication, in group 1, performed total hysterectomy, show 5 vaginal mesh exposure. 3 patients were treated with local therapy, while 2 patients underwent surgical removal of mesh. In group 2, no vaginal mesh extrusion showed. Quality of life improved in both groups, but in group 2, there were a higher satisfaction than group 1. In conclusion, this study demonstrated that both techniques are equivalent as regards anatomical and functional outcomes. However, laparoscopic colposacropexy plus subtotal hysterectomy is associated with a low risk of vaginal mesh extrusion. Thanks.
Thank you for your presentation. I wonder, how did you get this study through your medical ethical committee? Because literature until now already has shown that total vaginal hysterectomy before and doing a sacrocolpexy has more erosions. In my country, this study would never have been approved.
This is approved in with the commit, yeah.
Do you understand what I'm asking you? So, in my country, we read the literature which has been the studies which has been performed before. And the literature shows that if you perform a total hysterectomy combined with sacrocolpopexy, you will have more erosions. That does not benefit your patients. So every medical ethical committee would say, you can't approve of such a study.
Your ethical committee doesn't approve this study in your country.
Yeah.
But
because we knew the outcome already.
Yeah, because the benefits is low
Now,
than the
complication rate of a total hysterectomy combined with sacrocolpopexy.
In our university, this study is approved by ethical committee because our mesh exposure rate is low. Because is only 5 patients, and so it's not a problem for ethical committee.
Please.
However, in literature there are more trial on sacrocolpopexy, retrospective or prospective trial. With sacrocolpopexy plus subtotal hysterectomy or total hysterectomy. The particular of this trial is a randomized, but in literature there are many this type.
Yeah. We'll just take one more question. Thank you for your trial. I think there is indication for total hysterectomy with laparoscopy, sacrocolpopexy. My question is, how do you perform closure of the vagina for total hysterectomy? Vaginally or by laparoscopy? Do you use special material like V-lock or things like this? Two-layer closure?
We perform the closure of a cuff of a vagina with by laparoscopic approach, no vaginal approach, with absorbable suture, vacuolar absorbable.
One layer?
One continuous suture.
Thank you. Thank you very much.